restorative doctors, and Road Dental Lab is the lab that is going to assist us in making the final restorations. So here we have Claude. We're going to take our normal pictures to evaluate the tooth position for our facially generated treatment planning. His chief complaint is, I want to improve my smile. Again, we're going to evaluate every aspect using diagnostic models, x-rays. We see that he's got failing restorations, recurrent decay, open embrasures, periodontal disease, increased pocket depths, poor plane of occlusion. And we're going to do just exactly what we did in terms of treatment planning for the other patient. His final decision on his treatment was an upper and lower pro arch. It's going to be fully guided smile in a box, and it's going to be immediately loaded conversion prostheses. And the final restoration is going to be full arch monolithic zirconia. So here we are again in review, just to make sure you understand the guide sequence. This is also a stackable, this is not a stackable, this is a sequential guide system. These are the pin guides used to make the initial osteotomy holes. These are the bone reduction guides for both upper and lower arches. These are the osteotomy guides with the little marks on them so we can reproduce the timing of the of any of the angled implants. And here is our conversion prosthesis, which will fit into those pin guide osteotomies. So here we go on the day of surgery. We try in the prosthesis, fits perfectly. We make sure that it's very stable. And again, just like we said before, we're going to drill one hole and then we're going to place a pin, because each time we place a pin, it's going to make that more stable. In cases where I've seen doctors just drill all the holes first and then put the pins in, I've seen sometimes they really have a hard time seating the pins, because as the assistant is trying to hold that, sometimes they move a little bit, sometimes it just shifts in the slightest degree. So if you go one osteotomy, one pin, another osteotomy, another pin, you're not going to have that problem. That's the best way to do it. So here we go with all the pins in place. You can see how precisely the guide fits. No space between the little windows and the teeth. The teeth are extracted, and the bone reduction guide is put in place. Again, you're going to see all the bone below that guide is going to be reduced. So our surgeon's going to use his carbide burr or whatever is his treatment of choice and remove the bone, flatten that bone buccally to lingually. And we're going to kind of just go through the surgery quick because we've seen it. We're going to use our pins in each of the little metal cylinders and follow the drill sequence that is provided by Smile in a Box. We're going to place that implant through the guide. We're going to do our profiling so that our SRA abutments will seat completely. That is the SRA abutment mounted on an implant. And here's some part numbers if anybody's interested in that. So here we have all of our SRA abutments in place. Some of them are angled, some of them are straight. SRAs can be 30-degree angles, 17-degree angles, or straight. We've now taken off our osteotomy guide, and we're going to place our conversion prosthesis in those same holes. We're protecting those abutments and the surgical site with some little rubber dam pieces. And we're going to inject our stellar in and around those cylinders to pick up this prosthesis. Here's how it looks coming out. There's the denture man. He's going to take this, fill in all the voids, polish it up really good while the surgeon's doing the suturing. So this is our PMMA conversion prosthesis, upper and lower treated. This case took us about 7 hours from start to finish. Everything lined up pretty good. and the patient went home very happy. This is about 3 days later. Everything looks pretty good, maybe a little midline discrepancy, but I'd say that's pretty successful for a double arch. And again, those the occlusal screws are torqued to 15 Newton centimeters. He's going to wear that for about 3 months. At the 4-week period, we're going to see him for a check, a healing check, and also to teach him how to clean the prosthesis and also give him a water pick. We're also going to check the occlusion to make sure nothing has changed. So once the surgeon has given us the okay that the implants are healed and ready to go, we're going to take off the prosthesis and we're going to retorque those abutments to 35 Newton centimeters. This is, number one, a check to make sure that the implants are completely healed. And also, a lot of times when you are placing those abutments at the time of surgery, there could be some blood in there, a little piece of bone or something, and it doesn't completely seat. So most of the time, these screws turn a little bit more at that 3-month period. For our initial impression, we're going to do our closed tray. We're going to use our closed tray impression copings, and we're going to do that double impression, 2-step impression, where we use the putty with a spacer. We're going to take that out after about 3 minutes, and then we're going to use our Panasil monophase within the tray to get our initial impression. Again, this is not supposed to be a perfectly accurate impression. This is just to make our verification jig. So here's that preliminary model. We're going to make our jigs on those open tray impression copings. We're going to place a spacer so we have room for our impression material, fabricate our custom trays, and then we're going to bring our jigs to the mouth just like we did on Mrs. Comer. The jig will be separated. We'll connect the jig using our ViSalus temporary material from Kettenbach. Let that set a couple minutes, and then we're going to do the same thing on the bottom. And we're going to take our custom tray, we're going to coat it with adhesive so that impression material doesn't pull when we're removing the impression, increasing the accuracy. And we're going to try that tray in the mouth just to make sure we have access to all those occlusal screws, because we do not want to lock this tray in or have to go fishing for those screws after the impression material is set. There is our final impression using Idanium medium as the tray material and Idanium light as the syringe material that we have syringed underneath that impression jig. Here we have our master model. Again, we've captured all our anatomical landmarks that we need to help us set the teeth in the proper position. And what we do, and this is an adventure of the denture man, is when we're doing our impressions, he's duplicating the conversion prosthesis just to create a backup duplicate that we can send to the laboratory to do our final tooth planning. And the way that he does that is that he makes a little sprue with the white wax, mixes up some putty, puts it over that prosthesis, and then he's going to use either a pour material or an injection material to create that clear white duplicate of the conversion prosthesis. We use this when the conversion prosthesis is pretty close to the tooth position that we want. If there's a big discrepancy, many times we'll just go back and we'll do a complete new setup in order to plan our tooth position. So here we go with the duplicate prostheses fabricated. We're going to put it in the mouth. We're going to check the vertical, usually because there's a little expansion and shrinkage. The vertical is usually a little bit open. So I'm going to go in and I'm going to reestablish the correct vertical by doing some adjustments and creating equal contacts on all surfaces of this duplicate prosthesis. So here we are adjusting it. Here's the prosthesis in his mouth at the proper vertical. We're going to take photos so that the lab could see that, yeah, that midline looks like it's off to the right a little bit. And so they can bring in a brand new tooth library, make all the corrections necessary. You can see the teeth on the left are up a little bit higher than the teeth on the right. So they're going to make all all those corrections. They are going to scan those duplicate prostheses, and then they'll be able to import it into the software to make those changes. So there's the duplicates mounted on our master models. There's the lab scanner. And here are the PMMA milled prototypes that they fabricate from the information that we've given them. Just another view of the prototypes. And we're going to seat those prototypes, adjust the occlusion, get everything perfect, and then we're going to send that patient home for about 2 weeks, or sometimes even longer, for the patient to evaluate the aesthetics, the phonetics, and the function. Once he's happy with all those, he calls us up and says, "This is great." We call the lab, and we have the lab make the permanent monolithic zirconia restorations, and this case was done with the support from Roe Lab, specifically Sam Malik. And here's our patient in his final zirconia prosthesis, happy as can be. And in closing, why do we do full arch restoration?